Welcome back to Tipping Point. I'm your host, Kara McKinney. How far will the left go to restore Roe, as Biden's campaign slogan puts it? We'll check out this line by our next guest about the pro-abortion arguments being made before the Supreme Court by the Biden administration in Moyle v. United States and its companion case regarding Idaho's abortion law. Taking a turn of phrase from the late Justice Antonin Scalia, he quips, quote, "It's a classic elephants-in-mouseholes claim to say that a federal program to provide health care to the elderly contains an unwritten rule requiring abortions. It just doesn't pass the straight-face test," end quote. Joining us now to discuss is Dan McLaughlin, a senior writer for National Review and the author of this piece. Dan, thanks for being here tonight.
Glad to be here.
Great. So first, I just have to ask, because I love me some Antonin Scalia as well, but what's the story with Justice Scalia saying that Congress doesn't hide elephants inside mouse holes?
Well, this is something that we've seen the Biden administration in particular trying to do in a lot of cases, which is taking some sort of vague, broadly written law and saying that it does some highly specific thing on a very important or controversial issue that isn't even mentioned in the statute. And that's exactly what's going on here.
Definitely. And so I think the acronym is EMTALA, but it stands for Emergency Medical Treatment and Active Labor Act. That's the big one right now under consideration. If you listen to the administration or other pro-abortion activists, they'll say that this cuts at the heart of Idaho's law. Can you explain for us, though, how they're trying to basically weaponize this law and, like you said, claim that Congress actually hid an elephant inside that mouse hole back in, I believe, 1986 when that law was first passed?
Yeah, and it was signed into law by Ronald Reagan, who was a pro-life president. So, and passed through a Republican Senate, the same Senate, in fact, the same year that confirmed Justice Scalia. So, this was a law that was intended at the time to deal with a very specific problem, which is hospitals turning away people from their emergency rooms who couldn't pay. So the idea was to ensure that, people who couldn't pay would get the same treatment as people who could. What Congress did was pass a law using the leverage of the Medicare program. And they said, if you take Medicare as the hospital, if you take Medicare patients, then you have to take everybody who walks into your emergency room and give them emergency treatment, whether or not they can pay. And so that was the entire purpose of the law. It doesn't say anything about abortion. It, in fact, talks about the need, because a lot of the people coming into emergency rooms were pregnant women in labor. And so it talks about the need to provide care to the unborn, to unborn children. It specifically mentions that. Now, what's weird about this, first of all, is that they use the leverage of the Medicare program. And there aren't really a lot of pregnant women on Medicare coming into hospitals. So already Congress was sort of stretching its constitutional authority pretty far in ways that are possibly dubious. But what happened after the Dobbs decision, the Biden administration was casting around for new ways to crack down on states having pro-life laws, which was exactly what Dobbs was about, was saying that the Constitution doesn't prevent them from doing that. And so with Idaho's law, which had a life of the mother exception, but no broad health exception, the Biden administration immediately filed suit right after Dobbs and said, under EMTALA, you have to provide emergency care, even if that includes an abortion. And there's no basis on that in the statute for that, because what Idaho's argument is look, we just have to provide the same care that would be provided to a paying patient. And a paying patient is subject to Idaho's laws, Idaho's standards of medical care. There's nothing in EMTALA that establishes a nationwide standard of medical care, but the Biden administration claims to find it in the statute.